Welcome to the Kirby Pines internal COVID-19 update. Let's join Anna Bradford and Chris Palmer in a Q&A with Dr. Mike Abutini.
Dr. Abutini, could you go over some of the guidelines for us in the medical area that we could do on a day-to-day basis to prevent the spread of the virus?
Well, hello everybody. First I wanted to say I hope everybody is very healthy and safe, and I'm sure everybody's taking appropriate precautions as we are. I'm going to go ahead and take my mask on right now, take it off, because everybody's far apart from each other here, at least 6 feet, if not 10, so just so that you could hear me better. But it is extremely important that everybody does keep their mask on all the time, please, especially when you're around people. I cannot stress that enough. That's probably the single most important thing that we are now found that will help prevent the spread of the coronavirus. In the medical areas, as in even in independent areas, absolute cleanliness, disinfecting all the time, keeping people's distance, keeping masks on is done all the time. In the medical areas, we are testing all our employees on a weekly basis, on top of doing all the survey questions and all the temperature checks to try to catch the coronavirus real early so we could keep the spread from coming on. Because the single biggest risk to bringing coronavirus in the facility and spreading it is for somebody that goes out. You don't know what the kids were doing. They were exposed to some kids, especially now that the schools are back in. We're very likely that we're going to see a lot more people get exposed and get positive tests with that. So they could bring it back into the facility. So we don't want to wait till they're sick or they have symptoms. We want to catch them early on. And that's indeed what we've been doing, testing weekly. Now, when we get the test results back, we have had some positives with the employees. We immediately send those employees home. And then we do contact tracing, and we see who those employees have been in contact with in terms of the residents. And go ahead and test those residents whether or not they have symptoms. In some cases where the labs have been delayed because of all the stress on labs lately, there have been some delays in getting the test results back. We just went ahead and tested the whole facility. We have had a few residents that are positive, and we immediately moved those residents to isolation rooms in an isolation hall far away from everybody else, where they're on their own hall, and keep the maximum isolation measures regarding any of the healthcare providers that are taking care of them. Those healthcare providers are only taking care of those residents at this time, so they're not cross-contaminating and going to other residents' areas. We're monitoring the residents that are positive, and so far it's the ones that we have had that are in here have really been asymptomatic. We are catching them early, and we haven't had any major symptoms of the residents that are here right now. So we'll continue to watch them and make sure their potential for spreading COVID is at zero risk before we get them back out of isolation.
Dr. Abutini, would you go over some of the signs and symptoms that we should be aware of on a daily basis?
Very varied, and you could be completely asymptomatic, and that's a possibility, and that's what we're actually seeing more and more of now. In March, April, when this first thing, when the coronavirus first came to our attention and started spreading, people were actually extremely sick, and we were finding those people that are sick. Now, nowadays, we're seeing a lot of asymptomatics. I don't know if that's due to the fact that we're testing so much more, and we're doing the contact tracing immediately and testing everybody that might have been exposed immediately, even if they've been exposed to asymptomatics, or if we're seeing a different version of the virus that is starting to come around right now that might not be quite as bad as the original virus is. It's just hard to say at this time. But you could definitely be asymptomatic. Now, in the worster cases, you could start to develop fever, and that's typically the hallmark is a fever and a cough and shortness of breath. Those are the typical hallmark type signs and symptoms that you're going to get. A frequent and common sign and symptom we see is loss of sense of taste and smell. So you can get that as well, and that's actually little more of the common as far as signs and symptoms. So, as far as what we do here, when we see somebody, is getting sick and sicker, we'll send them out to the hospital. Otherwise, we'll monitor them closely. We monitor temperatures and we monitor oxygen saturations, on a regular basis throughout the day, and just to make sure they're not getting sick.
Does it appear at this time that a person can contract coronavirus or COVID-19 twice?
It's hard to say. We have had some people that have tested positive, then tested negative, then tested positive, and it's not really for certain if the negative test in between was a false negative, or if they got reinfected again, or if they got, sometimes they get sicker, but a lot of times any virus, including any typical cold or flu virus, can set you up for bacterial infections. So you could get bacterial infections on top of that. So were they sicker because of a bacterial co-infection that later on came on? Typically, once you got it and you recover completely from it, it's very unlikely that you're going to get it again. And if you do get it again, you're going to get immunity to where you won't get nearly as sick as you did the first time. And that's the expectations at this time, is how that would be.
Is there yet a vaccine for the coronavirus or COVID-19?
At this time, there are many companies and governments into major research and development. We are in the latter stages of development with a few different vaccines, and it does look like probably within the next 3 months we should have a vaccine out based on what's going on in the stages of development. They've gone through the first stage where they just tested a few people to make sure it's safe, the next stage where they tested more people to make sure they're having an antibody response, and now we're testing a whole bunch of people on the multiple thousand range to make sure that they actually not just have an antibody response, but do actually have a immunity based on the vaccine. And so far we're just waiting for those final results to come out, but everything seems to be very promising, and hopeful that in the next few months we should have something out. I just wanted to reassure everybody that here at Kirby, I really thank everybody here in terms of the medical staff, the maintenance staff, the administrative staff. Everybody has been working very, very hard to try to keep the virus, first of all, from coming in. We make sure that our residents are extremely safe and healthy, and same with our employees. And we have the complete support of our administrative staff here to do anything that we can do, and I will in every way possible try to keep this thing at bay.